Sometimes patients don't want to talk about the fact that they're taking an antidepressant. It's easier to say no than go into all this depth about why I'm taking this drug. There's still a bit of a stigma when it comes to these drugs.
Patients are still somewhat reluctant. And so there's a chasm there that we've got to cross at some point.
If they do tell you they're taking it, well, a couple of things have to pop in your mind right away. These drugs are known to cause clenching. You're breaking off cusps, you're fracturing crowns, or vertical fractures in the tooth. Not many people know these drugs cause bleeding because they interfere with platelet aggregation. They can reduce the successful osseointegration of an implant and cause early dental implant failure. That's an overwhelming responsibility now for a dental assistant to hear these words.
Hey everyone, welcome back into another edition of the Dental Assistant Nation podcast. My name is Kevin Henry, the founder of the Dental Assistant Nation, and I will tell you, I go a lot of places and a lot of dental assistants come up to me and they ask me one question. When is Tom Viola coming back on the podcast? And you know what, dental assistants? Today is your lucky day because we have dental's pharmacology expert, Tom Viola, RPH, on today. Tom, man, good to see you, brother.
Always good to see you, brother. I'm so glad we always have a chance to do these quick ones together. You and I are two ships in the night. Sometimes we see each other, sometimes we don't. We wave to each other, but I love these podcasts that we do because I really can reach out to the dental assisting audience and tell them how much I appreciate them and give them any tools I can.
Well, you know, and you and I were together at the Pacific Dental Conference in Vancouver. I popped in, packed room as always. I know people love to hear what you have to say because you're bringing the truth out there and some things that a lot of people aren't talking about.
Same could be said for you, brother. I walked by your room. It was pretty packed. I'm not going to lie.
It's what we do. You know, dental assistants need people talking to them, and that's where I think you and I have that common bond, and I'm so thankful for that, man. I am. So let's chat about something that is going on, we know is going on with our patients, and let's be honest, it may be going on with a lot of our dental assistants who are listening to this as well. And that's the rise of antidepressants and how that's kind of being used in our society today. What do our dental assistants need to know, Tom, about if a patient walks in and if they're on an antidepressant? What do we need to know here, man?
So, these days, there's just a lot of anxiety. No matter which side of the political spectrum you're on, there's just a lot of anxiety and a lot of depression because it depends on, the fact that some people, get into family squabbles over this stuff. They get into friend squabbles over this stuff. People feel like they can't express themselves, whatever it is. So there's a lot of this pent-up anxiety. And what I've been told by my medical doctor friends is that the prescribing of anti-anxiety and antidepressants is off the chart right now. Now, granted, a lot of people use cannabis or marijuana to self-medicate for anxiety, but we're seeing more now, from what my medical doctor friends tell me, more now than ever, people coming in and seeking, SSRIs like Lexapro, Prozac, Zoloft, and even some other drugs, sometimes even just to help sleep, like a drug like Trazodone to help them sleep at night. But those all fall into the same family as antidepressants. So what do we need to know about it from a dental standpoint? Well, the first thing you have to realize is these drugs are somewhat difficult to talk about. Sometimes patients don't want to talk about the fact that they're taking an antidepressant or, there is a certain stigma, not as much as it used to be, but there's still a bit of a stigma when it comes to these drugs. In addition to that, if they do tell you they're taking it, well, a couple of things have to pop in your mind right away. Number one, these drugs are known to cause clenching, and clenching is problematic. We're talking about everything from, TMJ issues, right, to what we call myofascial banding, which is pain in the face, which can easily be misconstrued as dental pain. You've got overdeveloped masseters, so now you can't open as wide as you'd like to. You get fractures because you're constantly clenching, so you're breaking off cusps, you're fracturing crowns, or vertical fractures in the tooth. Yeah. And then you need xerostomia, you need appliances, so it's a bit much, from a dental standpoint.
Yeah, it is. And I feel like since COVID, and I know we don't like to talk about that, but it feels like since COVID, we've really had this rise of medications that we need to help get us through the day and to help us get through society. And so I feel like, as you said, there's a stigma out there about it, and yet it's become so commonplace in our nation and in our world that I'm not sure that there really should be anymore.
Well, the good news is a lot of people now recognize the value of mental health, and aren't ashamed to talk about it, which I think is great. Again, why ignore the problem if it's there, right? But now here's the thing, Kevin. The good news is a lot of people in our industry know about this, but here's some things they may not know that are relatively new. So first thing is, yes, they can cause the clenching. Not everyone, though. So some people take them and don't clench. Some people do. So that's the first thing you're going to be looking for. But then the bleeding.
Hmm.
Not many people know these drugs cause bleeding because they interfere with platelet aggregation. And that's interesting because why would anybody associate an anti-anxiety medication with something that would make you bleed?
Right.
Okay, so a relatively not so invasive procedure now where you wouldn't expect bleeding causes this kind of bleeding. And for a dental assistant and even the dentist in that situation, that could be scary.
Absolutely.
More
And
bleeding than you think.
I feel like anytime you and I talk, it goes back to asking about medications, the health history form, all those things. And I'm not beating a dead horse here because I feel like that's still an issue that we've got in our industry, that dental assistants are still somewhat nervous to ask and patients are still somewhat reluctant. And so there's a chasm there that we've got to cross at some point.
Absolutely. I just did a couple of big meetings and medical history always comes up. And so I asked the audience members, I said, how many of you could say that in this audience right now, how many of you could say that you left the office on Friday with every chart documented, every I dotted, every T crossed? How many of you can say, and like a few people raise their hand, but the majority of people say, well, no, I got to go back to work on Monday and finish that up. Well, that's the problem as well. If you don't, one thing is taking the complete and accurate medical history, which we all know is so important. But the other thing is your memory. Right? If you don't document at that moment, your memory gets a little sketchy. Even a day or two later, you may not be able to write down everything you were thinking at that moment. And as we all know, the three most important words are document, 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 right? You got to document everything.
Absolutely.
Even when it comes to these medications, because again, now you notice that they are more likely to bleed. That's got to get in the chart somewhere. So you'll know for next time.
So we know so many dental assistants are into oral surgery. We know that they love that part of this. But yet, I'm hearing you talk about the bleeding. I'm thinking about an implant. I'm thinking about extractions. I'm thinking about everything else where it's got to be critical to know this kind of information.
Yeah, and I'm glad you brought up implants because there's a couple of studies out there now that have suggested that because these drugs interfere with osteoclastic function, that they can reduce the successful osseointegration of an implant and cause early dental implant failure. So not the implants that are already osseointegrated, but like lately, the ones that have been placed lately.
Okay.
That's something I wouldn't even think of necessarily. How would I think an antidepressant or an anti-anxiety drug would make my implants fail?
All right, so let's go down that road for just a minute because I'm thinking whenever you're talking case presentation and you're presenting an implant to a patient, you've got to bring up this, hey, just so you know, there is a possibility, you know, and while we're never going to tell our patients to get off of an antidepressant or whatever it might be, it's important for them to know that there could be repercussions from it.
And that's what I love about dental professionals, Kevin. That's why I spent more years of my life than not hanging around with you, as I say, you dental people. Why? Because that's what we do. If I can count myself among you, that's what we do. We will treatment plan around all this stuff because we don't want the patient to stop taking that medication because we know it's so hard to get on a good medication that treats your specific suite of symptoms that I don't want to stop you from taking a medication. I'll work around it. And that's the beauty. So again, you find out someone's taking Lexapro or Prozac or Zoloft or, Celexa. Already, these are the first few points that should pop in your head. Pharmacology is the most important instrument anybody uses in dentistry any day because it allows you to almost write the medical history and write the treatment plan right there on the spot with one word. I'm on Lexapro. Okay, wow, I've got all those thoughts in my head now.
Yeah.
And you and I could do that almost on every class of medications, But what's interesting about this class, why we brought it up today, is because it's things you wouldn't necessarily think of. Implant failure, you think bisphosphonates, you think other drugs like that. But who thinks about anti-anxiety medications like the SSRIs causing implant failure? Yeah, it's only 2 studies, but it's enough for me.
It is absolutely enough. And I want to go back to something we talked about at the very start because a lot of patients are reluctant to talk about this. Is there something that to try to get it out of them that you just, as a dental assistant, you mentioned there could be some dental side effects, so we need to know about this medication? Or how do we try to draw out this if there's a little bit of hesitation on the patient side of things?
The way I've always found it easiest is to never say the word medication.
Okay.
Right? Never say the word drug, never say the word medication. Just very generically say, what do you take? And then maybe look back at you like, what do you mean, what do I take? What do you take? Like, tell me everything it is that you take. I want to know about medications, supplements, everything. Just tell me, if you put it in your mouth, I want to know what it is. And
Okay.
I think that opens up the canvas a little more because now they feel they can say anything and you'll be okay with it. But if you say something like this, like any changes to your medications, my answer is going to be no.
Right.
Because it's easier to say no than go into all this depth about why I'm taking this drug.
And I think we've got to hit the point that we say so often here on Dental Assistant Nation, and you've said it with me as well. People trust dental assistants. And so I think that there's a layer of trust that goes automatically with that patient dental assistant relationship where it may be easier for them to tell you, dental assistants, that they are taking a Lexapro or something like that, as opposed to maybe even the hygienist or the dentist.
Well, I'm glad you brought it up because that's the last point on this, Kevin, and that is, these drugs are also associated with suicidal ideation.
Mm,
And, unfortunately, that's a very real risk. And sometimes dental professionals, like dental assistants especially, are very welcoming. They're very approachable. They're easy to talk to. And you know what? If I have that comfort level with you, I just might say something like that to you that I wouldn't tell anybody else. Family members, I might, clergy person, I may not tell
sure.
anybody, medical doctor, but I might tell you. So that's an overwhelming responsibility now for a dental assistant to hear these words. What do I say in reply to that? So you give them encouragement, things like, hey, I've been there. Lots of people have been there. You get to the edge of your rope and you feel like all is lost, but call this number. These people will be happy to help you. I've known people who've called the number and they've gotten, great advice and great results. So don't feel like you're all alone. Even if it's a quick pat on the back or even a hug if you know the patient well enough, say it's going to be all right. It's enough to stop you in your tracks and say, wow, where did that come from? I never expected that. The two things you need to realize are be compassionate and keep their privacy between, where it belongs. Keep it between you and them. If someone opens up to you like that, you keep it to yourself because talking about it doesn't do anybody any good.
Absolutely. And I just want to bring up a quick point because dental assistants, if you're the person that we're talking about here, it's okay to ask for help. We've had podcasts on this, and I want you to go back and listen because it's important that we don't just sit there and try to get through the day if there's help available or that you need to talk about it. So that's a great point, Tom. It really is.
Hey friends, I'm heading to Nashville this year to speak at Accelerate the Dental Revenue Workshop. This isn't just another event. It's packed with real strategies, real solutions, and the kind of insight that actually moves your practice forward. If you're ready to grow, lead, and finally make your systems work for you, grab your ticket. Use my code KevinH to save $150, and I'll see you in Music City.
I always love having you on. I always love seeing you at these shows, man. But I know that there's a wealth of resources out there for people who will never see you at a trade show. And I want to make sure people know how they can get a hold of you, how they can learn more, and how they can, dive deeper into making sure that their patients stay safe in the dental practice.
Absolutely. So I try to post as much as I can on my social media. So you can find me anywhere on social media at Pharmacology Declassified, because that's what I want to do. I want to declassify pharmacology and make it something you can use every day, like an instrument, something practical, something applicable to dental practice. But you can also find me on my website, tomviola.com. And heck, if I'm going to be in a meeting and, anybody in this audience is going to be there, come by and say hi. Find me on the schedule, pop in my room. And maybe you can say hi to Kevin too while you're there because we're never going to see each other. So say hi on behalf of both of
Pass
us.
it along for us.
Send Kevin a message for me that says, "Hey Kevin, I see you. I'm in the other room."
So, hey, real quick, throw out some meetings where you're going to be over the next couple of months. Where might they see you?
Yeah, I'm going to be at Star of the North. Looking forward to that very much. Always a great
Absolutely.
meeting. I'm
Yep.
going to be at the Star of the South as well this year, so I'm doing both, which is amazing. Texas Dental Meeting, can't wait to do that. I've got Greater New York Dental Meeting at the end of the year. I just finished up with Hinman. I just finished up with Chicago Midwinter. So all great meetings this year, all great audiences, and I'm sure I'm leaving a few out, and I'll say later, why didn't I mention that other meeting? But there's so many in my head right now, I can't keep them all. That's a good problem to have, right? It's a
Well,
good news. So.
it is. And just dental assistants, so you know, when we release this episode, it's the Monday before Star of the North. So I'm just going to tell you, if you're in the Twin Cities or anywhere around the land of 10,000 lakes, come see Tom. Come see me because we're both going to be there.
All right.
The ships are actually maybe going to, touch each other as we get through here. So, but yeah, absolutely. Star of the North is great. Hey, good for you. You'll be in Texas a bunch. So I hope our dental assistants will take advantage of your expertise and come into those classrooms. So, Tom, man, thanks so much for the time. I really appreciate it, brother.
Always a pleasure, Kevin. Thank you for all you do for dentistry, my friend. You're a leader. I appreciate you very much.
It runs both ways. Trust me. I appreciate you. And hey, we appreciate you, dental assistants. We know your time is valuable. We know that you've got only a few hours in the day where you spend to get better at what you do. And we're thankful the Dental Assistant Nation podcast is part of that. So until next time, come see us at Star of the North or wherever we're going to be coming up this year, because dental assistants, we know education is so important, and we thank you for what you do every day. Until next time, it's Kevin Henry, founder of Dental Assistant Nation, signing off, and as always, wishing you nothing but success ahead.